Hi, and welcome to Essential Jobs. In this video we will discuss the role of a retail pharmacist. A retail pharmacist is a licensed healthcare professional who works in a retail pharmacy, also known as a community pharmacy. Their primary role is to dispense prescription medications to patients prescribed by physicians, dentists, and other healthcare professionals. In addition to dispensing medication, retail pharmacists also provide medication counseling to patients, advising them on how to properly take their medication, potential side effects, drug interactions, and any other questions or concerns they may have. Retail pharmacists also manage the pharmacy's inventory, order new medications and supplies, and ensure that the pharmacy is operating within legal and regulatory guidelines. They may also provide immunizations, conduct health screenings, and offer over-the-counter medication recommendations and advice. Retail pharmacists play an important role in ensuring that patients receive safe and effective medication therapy and help to promote good health outcomes. To become a retail pharmacist, you need to complete several steps, including: earn a bachelor's degree. While not always required, most pharmacy schools require applicants to have a bachelor's degree. You can choose any major, but you will need to complete specific prerequisite courses in biology, chemistry, and physics. Take the Pharmacy College Admission Test, PCAT. This is a standardized test that measures your knowledge and skills in areas relevant to pharmacy education, including biology, chemistry, and math. Complete a Doctor of Pharmacy, PharmD, program. This is a professional degree program that typically takes 4 years to complete. PharmD programs include coursework in pharmacology, pharmacy law, ethics, and patient care. You'll also complete rotations in different pharmacy settings to gain practical experience. Pass the North American Pharmacist Licensure Examination, NAPLEX. This is a comprehensive exam that assesses your competency to practice pharmacy. You'll also need to pass a separate exam on pharmacy law. Obtain state licensure. You'll need to apply for a license in the state where you plan to practice. Each state has its own requirements, but typically, you'll need to provide proof of education and pass an exam. Gain experience. Many retail pharmacies prefer to hire pharmacists with previous experience. You may need to work in a hospital or other pharmacy setting before transitioning to a retail pharmacy. Overall, becoming a retail pharmacist requires a significant amount of education, training, and licensing. It's a rewarding career that allows you to make a positive impact on the health and well-being of patients. The salary of a retail pharmacist can vary depending on factors such as experience, location, employer, and other factors. According to the U.S. Bureau of Labor Statistics, BLS, as of May 2020, the median annual salary for pharmacists, including those working in retail, was $128,710. However, salaries can range from $88,400 at the low end to over $170,000 at the high end. Factors that can impact a retail pharmacist's salary include working for a chain versus an independent pharmacy, location, and experience level. It's also worth noting that retail pharmacists may be eligible for bonuses and other benefits, such as health insurance and retirement plans, which can add to their overall compensation package. In general, retail pharmacists are typically well compensated for their education, training, and responsibilities, and can expect to earn a competitive salary in their field. Like any profession, there are both pros and cons to being a retail pharmacist. Here are a few to consider. Pros. Job security. The demand for pharmacists is expected to remain high due to the aging population and increased access to healthcare. Good salary. Retail pharmacists typically earn a good salary, with many opportunities for advancement and salary growth. Opportunity to help people. As a retail pharmacist, you have the opportunity to help people manage their health conditions and improve their quality of life. Flexibility. Many retail pharmacies offer flexible scheduling, including part-time and weekend shifts. Cons. Long hours. Retail pharmacists may be required to work long hours, including nights, weekends, and holidays. High-stress environment. Working in a fast-paced retail pharmacy can be stressful, with a high volume of prescriptions to fill and customer demands to manage. Potential exposure to hazardous substances. Retail pharmacists may be exposed to hazardous substances, including medications and chemicals. Limited career advancement opportunities. While there are opportunities for advancement within retail pharmacy, there may be limited options for career growth outside of the industry. Retail pharmacy can be a rewarding career, but it's important to consider the potential challenges and weigh them against the benefits before pursuing this career path. There are several trends that are expected to shape the future of the retail pharmacist profession, including increased use of technology. Retail pharmacies are expected to incorporate more technology, such as automated dispensing machines and electronic health records, to streamline operations and improve patient care. Expanded scope of practice. Pharmacists are increasingly being recognized as essential members of the healthcare team, and there is growing interest in expanding their scope of practice to include services such as administering vaccines and providing chronic disease management. Focus on patient outcomes. As healthcare shifts towards a more value-based system, there will be a greater emphasis on improving patient outcomes, and retail pharmacists will be expected to play a larger role in achieving these goals. Growing demand for specialty medications. As new specialty medications continue to be developed, there will be a growing demand for pharmacists with specialized knowledge and expertise in these areas. Increased emphasis on wellness. As consumers become more focused on wellness and preventative care, retail pharmacies are expected to expand their offerings to include more wellness products and services, such as health screenings and nutrition counseling. Overall, the future of retail pharmacy is likely to be characterized by continued innovation and expansion of the role of pharmacists in patient care, with a greater focus on using technology and data to improve outcomes and provide more personalized care. Thank you for watching this video on retail pharmacists. If you found it helpful, please like, share, and subscribe to Essential Jobs.